Julie, tell me what's going on with your elbow.
Well, I think I have an injury from some CrossFit lifting that I attempted to do, and tried to get physical therapy after that for both my elbows. That was not successful.
Okay.
So I went in for cortisone injections, and it worked for about 3 months, and now one elbow is now back to painful.
Painful, okay. So how much pain from 0 to 10 you feel there at worst?
I would say probably 8.
8. What kind of motion aggravated?
Just bending, gripping, lifting any kind of weight. Really, maybe about a 3 pound or more.
Okay, so you said before you had PT, you had cortisone shots. Okay.
Right.
All right, so as I mentioned to you, everything should not aggravate your symptoms, so let me know. Let me see, let's actually do the motion with the weight, and you tell me how much it feels now. Okay.
So it sort of hurts here.
Okay.
To lift this way.
Okay.
I would say that's probably about a 6.
6 out of 10, and you feel it there. Okay. Any other motion?
This motion. And then just the gripping.
The gripping itself, it's how much with that?
I would say about the same.
The same, okay. All right, okay, we'll take that. Let me see your range of motion. Bend all the way. Do you have any issue with that? Let me see both of them. Okay. All right, straight your elbow. That's a little bit tight, not too bad. Twist in like this and out. Okay. All right. So let me work on that. So this has been going on for the last 3 months.
Started in March.
In March and subsided and then came back.
So came back after about 3 months after the injections.
After the injections, okay. So let me, I'm gonna use this pill. Okay, can you take the... And you feel it localized here or going down to your...
Well, it's mostly here, but I feel it across my forearm. Yeah, when I'm gripping.
So that painful here? You feel that? Yeah. Okay. So can you explain to us what kind of treatment you had in PT? What did they do?
I had some ultrasound.
Okay.
I don't know what that tool.
So they use a metal tool
to... Yes, a metal tool to dig in and break up scar tissue, I
break up the scar tissue. How did you feel after that?
Very painful. It was very, very sore for days.
Okay. So I want you to tell me after the treatment, we're going to break the scar tissue compared to what you had before, the metal tool. Okay. This is not metal.
Okay.
Is that too much?
No.
Okay. And I actually feel the scar tissue there. Do you? You do? You feel this? You feel this one? Yeah. It's a scar tissue. Okay. It should feel like nice and smooth like this. You have a little bit scar tissue here and a little bit here. You feel this one? You're gonna feel it more actually with the instrument. It's actually it's easy to feel it more with the instrument. Is that too much for I'm doing here?
No.
Make sure that's not irritating your centers. You're right-handed?
Yes.
Okay. So you feel pain with typing or writing or something like that?
Not too much with that. It's mostly lifting. Bending.
So you're gonna feel cold, okay? You feel this one here? That's a scar tissue. Is it painful? It's okay. Okay. And you have scar tissue. Did you injure your shoulder?
No.
Your biceps?
Not that
triceps? And you will see the scar tissue there's redness and you feel the bump. You feel that?
Yes.
It should feel like nice and smooth like this.
Okay.
Can you tell the difference?
Yes. Yes, I can.
Okay. Did you feel loss of scar tissue with the other instrument when they use it?
I didn't look for it. He didn't point it out to me, so.
Okay. Yeah, I made this design specifically to use it for assessment to help to actually detect the scar tissue. So, you feel this? Is that painful? It's okay.
A little bit.
Make sure it's pain-free, okay? Not aggravating your symptoms. So there's fine line actually between breaking the scar tissue and causing the scar tissue.
Okay.
If you get any treatment and you feel pain while they're using the instrument, they actually cause more scar tissue, more trauma to the tissue. And that's actually, it's actually contradicts with the treatment itself.
Right.
You know, you try to break a scar tissue and you're causing more scar tissue,
right.
You're gonna start that healing cycle again and inflammation. That's why I don't want you to feel pain while I'm working on it.
Okay.
I want to make sure it's not causing trauma, we're just breaking only the scar tissue. Are you okay with that?
No.
Okay. Is it too much? It's okay.
It's okay.
Make sure it's not painful. So let's say after we worked on it for a few minutes, let's move your elbow and tell me how that feel.
Feels much better. A little looser. I still feel a little bit of tension here, but much better than it was. Probably went from an 8 to a 3.
And can you tell, because you had before like those instruments before the metal one, can you tell a difference between the treatment you had before and ASTR treatment?
Yes, this feels, obviously it feels like you worked on it, but when I had the metal, it was pain.
It was painful?
Yes, it was painful. Yeah.
Okay.
So like painful for a few days after.
After the treatment?
Yeah.
Okay. But did you feel pain with the treatment we did today?
No.
Okay. So what do you think about ASTR treatment?
Yes. So far so good.
All right. Awesome. Thank you so much.
Yes, thank you.